Hello everyone and welcome to Boundless Dentistry. In this video we'll talk about selection of prosthetic teeth, how prosthetic teeth are selected and on what basis the teeth are selected, what are the uses and different materials that are used to make these teeth, and finally what factors should be considered when placing this tooth in the denture. So let's get started. So when the teeth are lost from the oral cavity, the patient visits the dentist and different options are given. Dentures, dentures being one of them. So then the patient is presented after clinical examination of the patient. The patient is given certain choices regarding teeth selection. Now selection of teeth is important because not only because of aesthetics, how the tooth will appear, but also functionally that that the tooth functions well in the oral cavity and carries out its respective function. Now, what are the different guidelines that are available for teeth selection? There are three. First is size. By size, we determine how large or small or same size of the tooth is required as it was of the denture or of the previous record of the patient. Secondly, color. Color tells us how bright or dark the tooth should be as per requirement of the patient. And shape, finally, should the teeth be as it is like it was when the patient's previous records, or curved, straight, or there should be some amount of wear. So this all depends on the patient, but dentist also plays its part by suggesting the right choice for the tooth. The patient and dentist together, they choose the perfect teeth for the patient, and dental technicians should not play any role in selection process. Yes, the technician does play a part in making these dentures, but the selection process of size, color and shape should be done by the dentist and the patient only for to achieve the best results. Now talking about the materials that are used to make denture teeth, the two most commonly used materials are acrylic and porcelain. Now firstly talking about acrylic, acrylic is the most widely used, and when acrylic is placed in the oral cavity, it does not cause any wear of the natural teeth that is present in the opposite dentation, and it also binds chemically to the denture base to which it is inserted. Now, indications for acrylic teeth to be used in the oral cavity is that when the opposite dentation has gold crown or there are natural teeth present, and secondly, advantages of acrylic teeth are they are inexpensive, they are easily available, they absorb significant amount of stresses, they don't wear easily, and they don't make any sound when they impact with other teeth in the opposite direction. Now, talking about disadvantages of acrylic, acrylic wears easily, and because of its wear, the vertical dimension of acrylic decreases and it stains and discolors over time as it is being used as compared to porcelain. On the other hand, talking about porcelain, porcelain is more aesthetic as compared to acrylic. It is less wear time as compared to acrylic, and it bonds mechanically to the denture base, not chemically. It has an interlocking mechanism where porcelain binds to the denture base. Porcelain should be used when the good amount of inter-ridge space is available and the ridges are also well formed and superior aesthetics are required. But certain contraindications are also present when the natural teeth are present in the opposite direction when porcelain is inserted, because porcelain results in wearing of these natural teeth that are present. And talking about some advantages of porcelain, porcelain do not wear easily, same as we have talked before. It doesn't stain easily, and regarding mastication, it's very efficient. But there are some disadvantages associated with porcelain as well. There is clicking sound on impact with the opposite tooth, and they are difficult to grind if the height is to be decreased, and it abrades gold crowns, bridges, and as we've talked before, natural tooth as well. So anyhow, it is dentist's preference and its clinical experience depending on which tooth material is to be used, either acrylic or porcelain. Okay, now talking about selection of anterior teeth, particularly its width, it's based on two phenomena. We have the pre-extraction guides and we have post-extraction guides. Now in pre-extraction guides, we have diagnostic casts which are made for the patient so that they can, as well as the dental surgeon so that it can visualize the anatomy of the patient teeth, and we have photographs, radiographs, and extracted tooth. Basically, the importance of these pre-extraction guides is not as much as compared to the post-extraction guides, which we'll discuss now. In post-extraction guides, we have size of the face. Now, size of the face simply means that if a patient has a big face, the teeth should be big, and if the patient has small face, the teeth should be small. Opposite is also true. For example, big face, small teeth, and small face, big teeth. So this can also happen. Now secondly, corners of the mouth. Now corners of the mouth, they are used as a reference for maxillary occlusal rim, and at this point the distal surface of canine is present, like here. Now at these points distal surface of the canine is present, so these are used as a reference for setting up the anterior teeth. Now next is ala of the nose. Ala of the nose can also be used as a vertical line is dropped from the ala of nose and marks the middle of the canine. So this is used as an interalar guide for teeth selection. For example, these are your ala and these are the mouth. So if a line is dropped from the ala like this and this marks the mid of the canine. So this is also used as a guide for the arrangement of teeth, and this is known as interalar guide. And now talking about bizygomatic width, the zygomatic bones are your cheekbones. So if you have to draw cheekbones over here, okay, so we measure the distance in between them, and when we measure the distance in between them, we divide it by 3.3, and when we divide it by 3.3, we get the width of upper 6 anterior tooth. We get their width, actual width, and the same bizygomatic width, if we divide by 16, we get the width of a single incisor. So this is also a reference mark, and it's known as anthropometric reference point. Lastly is the cranial circumference. Cranial circumference is basically if a cranial circumference is combined with the anterior upper width, the ratio is 10:1. So 10 is the cranial circumference and 1 is the width of the upper anterior incisors. So that's all about selection of anterior teeth width. Next, talking about selection of anterior teeth height. First is assess lip line. Now, by lip line we mean that when the patient is asked to smile, the occlusal rim is exposed. Now, when the occlusal rim is exposed, the incisor-gingival or the height of the teeth should be that it should be greater than this occlusal rim, so that the patient doesn't have a gummy smile and teeth are visible. And similarly, a gingival recession can also be make to happen here if a patient is aged, so that a natural appearance occurs of the dentition of the patient. And second is the interarch space, which is basically the space between the arches. So if the interarch space is less, smaller teeth will be used. So this was about height of selection of anterior teeth. Now, selection of tooth form basically consists of pre-extraction guides, which are the same that we have discussed before, which consist of diagnostic cast, photographs, radiographs, and extracted tooth. These are to an extent not that helpful. So next is the Lyon-Williams theory. Lyon-Williams theory simply states that the tooth of a patient is selected by keeping the face form in mind. So for example, if a patient has a square face, so the tooth should be square shape, and if the patient's face is tapering, the tooth should be in a tapering form, and if the patient's tooth is ovoid, the tooth should be in an ovoid form. So this is what Lyon-Williams theory suggests. Second is facial form. Facial form simply means that if, for example, the face is square, tooth will be squared. If the face is tapering, the tooth will be tapering, and if the face is ovoid, the tooth will also be in ovoid form. Proximal form simply states how the tooth appears from the sides. For example, if a tooth is flat, it will appear something like this, and if a tooth is convex, it will appear something like this, the convexity like this. Next talking about the incisal form. Incisal form is simply when you view the tooth from above, two appearances can be noticed. One is this convex one. You can see how the incisors surface is convex and second is flat. So two possibilities are present. One is flat and the other is convex. Now, talking about the dentinogenic concept, it simply states that the tooth is selected on the basis of gender first, then personality, and then age. Firstly, talking about gender, for example, if a female patient visits your clinic, that the type of teeth that you will select will be in delicate appearance, the angles of the tooth will be rounded, the lateral incisor will be small and placed at slightly higher level as compared to central incisors. And if a male comes to you, so the tooth will be darker in appearance, the angles will be sharper, and the laterals will be wider. So this is how the dentinogenic concept is applied on gender, and you select the tooth according to the gender. Next is personality. If a patient comes to you has a vigorous personality, then the central incisor will be wider. There will be worn out appearance of the lateral incisors and canine, and the tooth will be in darker appearance and the angles will be sharp. And on the other hand, if a patient's personality is delicate, the tooth will be pale, rounded, and will have a slight feminine appearance. Lastly, talking about age, making teeth according to the age brings out the natural appearance, which otherwise, if for example there is an aged patient and you give them very bright teeth, very aesthetic tooth, so that will not look natural. So it will not be as appealing as it should be. So for example, there is an aged patient, so you should make a teeth that is not that white as compared to a young patient, and the patient might request for restoration, the grinding of some tooth, including wear facets, so that natural appearance occurs to the tooth. So this was all about dentinogenic concept related to gender, personality, and age. Okay, so now talking about selection of tooth color, there are three definitions that you have to know. First is hue. Hue is the basic color of the object, that is it. Chroma is the saturation, the degree of saturation or the amount of color that is present in an object. Value simply means brightness, how whiter or black the object is. That's it. These three definitions you have to know. Now, talking about color variation in natural teeth, the age has its effect because as the person ages, the tooth becomes darker in its color, mainly because of deposition of secondary dentine around pulp, which causes the tooth to become more translucent and has a yellowish appearance. Talking about effect of wear, the effect of wear mainly is brought by when the tooth are grinded together or by toothbrush, and because of this wear the tooth appears smooth and glossy, and this wear is particularly bothersome at the cervical area, which and then because of this wear the staining appears at these areas. Now talking about gender, males tend to have darker teeth and females tend to have lighter teeth. Now talking about demineralization, because the plaque has accumulated for different reasons, for example because of not brushing and the plaque is not removed, the stains absorb into the plaque, and when remineralization occurs the stain is stuck in the plaque, and by normal hygiene measures this cannot be removed. So this is problematic for the patients, and this most likely occurs at the cervical area where plaque accumulates and staining occurs, and only by professional hygiene measures the staining is removed. But again, it's not easy, it's difficult. Now the color of the tooth can be selected according to the color of the face, but this is not a very good practice, as it is said that the lighter skinned person has lighter teeth and the darker skinned person has darker teeth. So this can be used, but it's not widely practiced. And the correlation with hair and eye color of the tooth, this is also discontinued. It's no more practice. The standard practice of to select the teeth is first to place the shade outside the mouth to select the basic color as shown in the picture. Then the shade guide is placed below the lip so that only the incisal surface is showing, and then you see the shade with the adjacent tooth, and then finally you ask the patient to smile and the whole of the tooth is the whole of the tooth appears, and finally you select the best possible shade for the patient. Now some useful tips for color selection is that the color selection should be performed in a daylight, preferably near a natural light source, and lipstick should be removed when selecting a tooth because it disturbs the selection of the tooth color. And the color selection should be made as quickly as possible because prolonging the process might fatigue and confuse the eye, and the shade which is perceived by the eye might change. So these are some useful tips when selecting the color of a tooth. Now talking about selection of posterior teeth, there are certain requirements that has to be fulfilled when selecting posterior teeth. That is, the main purpose of posterior teeth is mastication, so they should be efficient, very efficient in mastication. They shouldn't irritate the soft tissues around them and below the denture, and no bone resorption should occur. That is main thing, because one of the problems that is associated with dentures is bone resorption. And finally, some amount of aesthetic is also required here, because up till premolar and somewhat first molar during smile, these teeth are visible, so aesthetics is also a concern here. Now talking about selection criteria of posterior teeth, firstly color. Color should be similar to anterior teeth, and in the entire mouth, canine has the darkest color, and then premolar and molar, they are slightly lighter as compared to canine. Now talking about mesiodistal width, in the mandibular teeth, the space that is available for the posterior teeth is from the distal surface of the canine to the anterior border of retromolar pad. Now teeth should not be placed at the retromolar pad directly, because this can lead to tipping of the denture, and also the teeth should not be placed at severe slope, which can dislodge the denture. Now talking about the mesiodistal width of maxilla, the space that is available for placement of posterior teeth is from distal surface of the canine up to the anterior border of maxillary tuberosity. Same goes for here as well, that the teeth should not be placed on the maxillary tuberosity for the similar reason where tipping of the denture can occur, and also the teeth should not be placed where there are severe slopes. In case of severe slopes, the last limit where the tooth should be placed should be the anterior border of the slope. Now talking about buccolingual width, the buccolingual width of a tooth should be slightly less than their natural counterpart, because of the narrow occlusal table reduces the force that are necessary for mastication to occur more efficiently. So less forces are required for more better mastication, and favorable form of polished surface can also be developed. Lastly, talking about occlusogingival length, the occlusogingival length of the teeth should correspond directly with the interarch space available. If the space is less, smaller teeth should be used. If space is more, larger teeth can be used. Lastly, talking about classification of posterior teeth. First, we'll talk about what is a cuspal incline. Cuspal incline is defined as an angle formed by the inner incline, which is this, with the working cusp to the horizontal. This is the angle which is the cusp incline, and this is important when we are selecting which type of posterior teeth should be used. So there are type of posterior teeth that are used. First is non-anatomic, which is also known as monoplane. Monoplane because it is flat, it has no angles and has no anatomy. Second is anatomic, and third is semi-anatomic. So monoplane is quite simple. It's like simply like a box. It has no anatomy and it's simply placed there. Now there are certain indications, because when this monoplane is used, it's used when there is severe resorption of the ridge, and when it is used, there is freedom of occlusal movement from centric to eccentric positions, and there are no lateral forces uh, present on the underlying tissues. The forces occur in this direction, and in this lateral direction forces are reduced. So this is an advantage of monoplane when it is used. But talking about some disadvantages, they are not as aesthetic and they are difficult to balance when used in the mouth. Now talking about anatomic, in anatomic there is some anatomy present, and in that cuspal inclines are present. For example, this is a anatomic tooth, and you can see how cuspal incline angle is present over here, and these can be used when well-formed ridges are present and good retention can also be achieved, and when balanced occlusion is planned, and where accurate jaw relations can be recorded and transferred to the articulator. There are some advantages associated with it, that is, it's easier to use, the biting efficiency is more because the anatomy is present on the occlusal surface, so better shearing or chewing of the food can take place. But one disadvantage is that it does lead to some bone resorption because there is some amount of lateral displacing force that was not present in the monoplane teeth. Now lastly, semi-anatomic teeth are basically similar to anatomic teeth, but their incline is less steep than the conventional anatomic teeth. In the conventional anatomic teeth, the angle is 33 over here, but in semi-anatomic this is less. So this was all about selection of uh, prosthetic teeth, mainly for making dentures. So I hope you found this video useful, and if you like this video, please like, share and subscribe. So until we meet next time, thank you for watching this video.